In today's lesson, we will cover understanding word meaning. Imagine this. Our journey continues with Andriana, who is pursuing a pathway to becoming a certified nursing assistant, or what most people know this profession as, CNA. Andriana is 24 years old. She doesn't feel at ease with speaking in public because of her English proficiency. Andriana struggles with speaking English and is hopeful to tackle it at her new AdultEdMed program, where she applied for a job as a CNA. Not only does she have a bubbly personality, she loves helping others. Andriana has interviewed for a job as a certified nursing assistant at the new AdultEdMed hospital. Although she is feeling confident in herself about how the interview went, she still feels that she might struggle with her competency as a CNA when relaying relevant information. As a result, she wants to improve her comprehension skills when it comes to vocabulary comprehension. Andriana would like to understand unfamiliar words that she will have to recognize while working with others, especially her clients. Do you know how to understand the meaning of unknown words? If you struggle like Andriana does, then this lesson is going to help expand your vocabulary comprehension skills as well. Understanding vocabulary in informational text, you need to know that vocabulary instruction is done explicitly and methodically. According to Stahl and Kapanis, some words are not likely to become part of one's vocabulary without direct instruction. In addition, effective vocabulary instruction helps students understand what they must do and know in order to learn new words on their own. Since Andriana is seeking a position as a certified nursing assistant at the newly built hospital, she must be able to understand how to determine the meaning of unfamiliar vocabulary words and connect how they are used in context in medical documents, including instruction manuals, evaluation charts, incident reports, and emails from supervisors. To fulfill the many duties as a CNA, it is important for Andriana to improve her reading, writing, and speaking skills in English. Making connections between new words and the context where they are located is vital to her success in the healthcare industry. Together, we're going to review 4 different ways Andriana will improve her vocabulary. Then, we will review to see which strategies are being implemented to discover the meanings of unknown words in a passage. According to the website below, there are several methods that will validate the meaning when encountering new vocabulary words. Here is a short list of effective strategies that Andriana can use to comprehend a variety of medical documents, handbooks, and manuals that she will be reading. We will practice the following strategies only in today's lesson. Strategy number 1, use context clues such as synonyms and antonyms to determine the word's meaning. Strategy 2, use context clues such as examples and explanations to help define an unknown word. Let's begin. We will work on context clues by recognizing synonyms, words that almost have the same meaning, and antonyms, words that have the opposite meaning, that are either placed near the unknown word or right after it. Read these sentences along with me. Ask the patient to turn their head from one side to the other. This check should not be performed on a patient who has a neck or spinal cord injury, as it could aggravate or irritate the problem. Here is an example of how the synonym irritate is located right after the unknown word aggravate, and it is offset between 2 commas. This type of context clue is not difficult when the writer places a word with a similar meaning directly after the unknown word. Our next strategy is recognizing how the writer uses an antonym to help the reader comprehend the unfamiliar word. Let's read this sentence. In order to de-escalate a disoriented patient who is being verbally abusive, calmly assist the patient back to the supine position until they are balanced. Did you identify the context clue? If you said the antonym is balanced, you are correct. The meaning of disoriented means the opposite of balanced, which is unbalanced or confused. Notice this time that the antonym is not directly after the unfamiliar word in this case, but it is located at the very end of the sentence. As we continue, we are going to use another strategy using context clues, but this time we will identify how the writer used an example to help the reader, like Adriana, understand the unfamiliar term. Writers use words like such as, for instance, or for example to indicate another type of context clue to understand the meaning of an unknown word. Let's read the same sentence, but now it has an additional sentence to show how the writer used an example to help the reader understand. In order to de-escalate a disoriented patient who is verbally abusive, calmly assist the patient to the supine position to regain her balance. For example, once the patient is assisted to lie down flat on their back in a safe manner, they will become settled and orientated. Did you notice how the example was used to clarify meaning? Also, the writer used the example in the second sentence. Which type of context clue is being used here? Range of motion checks will help your patient to remain more comfortable and prevent complications arising from contractures, which are permanent shortenings of joints in their patients. You're right, the context clue used here is explanation. Contractures, which are permanent shortenings of joints in their patients, explains what contractures are. As you probably noticed, explanations do not have to be difficult or long. Let's move on to the next kind of context clue. In the following sentences, what context clue did the writer use? A patient requires a dressing change for the first time after surgery. The CNA is responsible to change the patient's bandage immediately after surgery to avoid infection. If you said synonym, you are correct again. The word bandage is synonymous with dressing. The synonym is not located directly after the unfamiliar word dressing, but it is in the following sentence. Do you recognize this one? What type of context clue did the writer use here? CNAs employed as home health aides handle many ancillary duties unrelated to medical responsibilities, such as housework and cooking. Yes, the context clue in this sentence is an example. The writer used the clue phrase such as with 2 household duties. Therefore, ancillary must mean additional, since CNAs may have to perform extra duties for patients when they assist them inside their home. Now, on to our last exercise as a whole group. This sentence might be a bit tricky since the context clue is written in the first half of the sentence instead of the last half. A physical therapist has been treating a resident's subacute broken wrist, but the CNA has been treating other patients' mild injuries. Did you recognize the context clue for the underlined word? Very good. It is an antonym. The word mild is the opposite of subacute, so subacute must mean moderately severe. Here is the last sentence of our review. A CNA, or one who assists patients with daily activities, requires licensing which varies from state to state. What context clue was applied here? You got it, explanation. Now that we worked on a couple strategies, when you read, you can take advantage of recognizing these effective context clues. As a reminder, when trying to figure out the meaning of an unknown word, these are some of the context clues you can rely on. Coming across a word that isn't in your day-to-day vocabulary doesn't mean you have to give up. Just use a word surrounding the unfamiliar word as hints to figure out what the puzzling word means. For more practice on determining word meaning by recognizing and applying context clues, go to this website for further assistance. As the saying goes by Paige Zachalidity, life is like an unknown word. You can't find the meaning without the context clues.